I'm Brian Shaw, SNAHC Certified Diabetes Educator. Thanks for joining me today with this video. Today we're going to talk about how to change the sensor on your FreeStyle Libre 2 continuous glucose monitor. If you have a continuous glucose monitor, you know it's handy to be able to check your blood sugar at various times of the day and see different trends for after you exercise or after you eat. We're very fortunate today to have Tina with us today. She's a Nashville Enterprise Miwok Indian and a very special patient, so she's going to help us demonstrate how to change the sensor on your FreeStyle Libre 2 continuous glucose monitor. We're going to divide this video up into 3 sections. The first one is preparing the needed supplies. The second section is applying the sensor. And the third section is getting the sensor and the reader to talk to each other once you have the new sensor in place. So let's start with gathering our supplies. Okay, let's talk about gathering our supplies to change the sensor. You'll notice that your continuous glucose monitor comes with a sensor, a replacement sensor that you change every 2 weeks once you're ready to do that. What we're going to do first is make sure that we have got the box and the applicator and the sensor, that we have a patch if we want to put it over the sensor if needed. We have our continuous glucose monitor ready for us, and we have some extra alcohol swabs in case we need them. First step is to take the box, pull on the pull tab at the edge of the box and open it. You'll open the box and you will see instructions. You'll see the applicator and you will also see the sensor. We can put the box aside for now. It also comes with alcohol swabs in the box. First thing to do is make sure that you have the applicator and the sensor. Peel off the lid of the sensor. Take the applicator and twist off the bottom. And then you'll notice that there is a line right here, as is there a line right there. You want to take the 2 devices, put them together where the line lines up, and you'll notice that you have to push it a little bit hard. Now you have the applicator and the sensor connected to each other. You pull it out, and the applicator has the sensor attached to it already. What we're going to do is we're going to apply this to the back of our upper arm now that we have finished applying the sensor to the applicator. All right, our next step is to remove the old sensor and apply the new one. So for that, we have Tina here again. I'd like to thank you, Tina, for being here and letting us use you as a model for removing the old sensor and applying the new one.
Thank you, Brian. I appreciate everything that SNAHC and as you being a health educator for me and my diabetes and just SNAHC period. I really love this clinic. So yeah, I'm grateful for being here and to be part of it.
Thank you. We're really glad that you're here. Are you ready to remove the sensor?
Yes, I am.
Perfect. Let's have you roll up your sleeve.
Okay.
Okay. And then what Tina's going to do is she's going to grab the edge of the sensor and pull upward.
Upward.
There you go. Comes off relatively easy. There's adhesive on the bottom. You just throw that in the garbage. Okay. Then what we're going to do is we're going to clean the area. Where would you like the new sensor placed?
Right up here.
Okay.
A little bit above.
So we're going to clean the area where the old sensor was to get rid of any of the adhesive that might be on there. And then what we're going to do is we're going to clean the area where the new sensor is going to go. So we'll put it approximately where it was before. The only place that you can put these sensors is on the back of the upper arm. You cannot put it anywhere else on your body. It's not approved for that. And we want to make sure that you have, if you're doing this yourself, that you do it at an angle that makes sense. And you'll see what I mean when I apply it in a minute. You can either do it yourself or you can have someone else do it for you. And in this case, I'm going to apply it to Tina's upper arm. Are you ready, Tina?
Yes, I am.
We're going to take the applicator that has the sensor in it already. I'm going to hold Tina's arm very gently and ask her to relax her arm. And I'm just going to take the applicator and press it gently against her arm and stamp it in and let the adhesive do its job. Pull off gently. We have now applied the sensor to her upper arm, and we have the applicator that we can throw away. Do you want a cover over your sensor?
Yes,
okay.
Please.
These are optional covers that you can buy on Amazon. They will cover the sensor, and there's a little place that does not have stickum on it that goes over the sensor. This will protect it in case you're showering, in case you're swimming. You can swim and you can bathe with the sensor on, but sometimes people like to have a little bit of extra protection, so we can apply the cover over that. It's kind of like applying a Band-Aid. sensor. Make sure that it is smooth. Remove the sticky parts. And now you can put your sleeve back down. Excellent, thank you. All right, the third step in our process is making sure that the new sensor and the reader are communicating with each other and that the reader senses that there's a new sensor in place. So what I'm gonna do is I'm gonna let Tina scan using her reader on her continuous glucose monitor and take us through the process of setting up the new sensor. Check glucose. Oh. What does it say?
Starting new sensor, well, and the sensor you're currently using.
Right.
Would you like to start the new one? Yes.
Yes. Okay, scan.
And scan again.
Makes a beeping noise. There's a warning that comes up. What does the warning say?
It's saying that, you know, if we take high doses of vitamin C, more than 500 milligrams per day, this may give us a offset on the sensor, so it's better to maybe, you know, not do that.
Right. So if you take high doses of vitamin C, check with your doctor. This device may not be as accurate if you take those high doses, so you just check okay. And then show us the screen. We have 60 minutes. We have a countdown of 60 minutes until Tina can get her first reading with the new sensor. Great. So we've replaced the old sensor. We've gotten the new reader set up to have you be able to read your first blood sugar reading in 60 minutes. Relatively simple, right?
Yes.
Thank you for being here with us today, and thanks again to Tina for joining us and showing us how to change her continuous glucose monitor sensor for her FreeStyle Libre 2 continuous glucose monitor. Check out our other videos on YouTube if you want to know more about managing diabetes in a healthy way, and we'll see you next time. Bye-bye.